So, good afternoon, everyone. So, as per the topic, today we'll discuss the role of homeopathy in degenerative disc diseases like cervical spondylosis, spondyloarthritis, spondylitis. So, how homeopathy can help in these kind of diseases? Well, first of all, we need to understand what is lumbar disc disease. Like, why it is called lumbar disc disease. Well, degenerative disc disease in the lumbar spine, it refers to a syndrome when there is wear and tear in the spinal disc. If you see the spinal disc, they're like shock absorbers of the spine, and they generally stay flexible whenever you change your position, you uh, bend backward and twist. They're very flexible. So as you get older by ages, they degenerates, and they, due to the wear and tear, they begin to break down and they not perform like good, and you won't have that same flexibility due to the wear and tear in the disc. So these all happen because nowadays the lifestyle changes and stress factors. There are many factors responsible that nowadays, very at the very young age, everybody is suffering from back pain, cervical spondylitis. So these are all due to some causes which has to be find out, and that has to be treated to get relieved. So some of the causes we can discuss, like dry out when the spine disc, because when you are born, the spine, the disc in the spine are actually made up of water. So as you age, they lose water and they get flatter. So the flatter disc cannot absorb the shocks as well. So these are the cause that we can cause the pain, and might be some crack as well. So the stress, everyday movements and minor injuries, like year and year after, it becomes gradually there is a breakdown in the spine, like wear and tears near the nerves, and that becomes slowly soft and becomes painful. So this is the reason the disc get bulge or slip out of place, and generally it is called as slipped or herniated disc, and due to this it affects on the nearby nerves. So I'm not going to get so many details, as we'll talk the management part more here. So like types of degenerative spine diseases, you know well that herniated disc is there, sciatica, degenerative disc disease, spinal stenosis. Then it comes spondylosis. Spondylosis, what is spondylosis and what is spondylitis? Both are very different things. Spondylosis, in it's commonly known as spinal arthritis, like arthritis of spine, and it is actually common age related condition which affects joints and disc of the neck and the back. And spondylitis, in this there is an inflammation of any joints between the vertebrae of the spine, and this may occur in OA, in rheumatoid arthritis, as well as or ankylosing spondylitis. So coming to the management part, how homeopathy can treat. We can treat cervical and lumbar degenerative conditions, and homeopathy can repair the lumbar area from advanced level of degradation. Homeopathy can treat the most stubborn disc prolapse irrespective of the condition, the chronic back pains, the sciatica. So how you can do it? First of all, you need to understand, you need to take the patient good history about the pain, like the modalities, where the pain is, how the pain is, the character of the pain, the location, the sensation, modalities, any cause, any history of trauma. So with complete history, any exposure, or it might be any stress cause, any trauma, it would be mental, physical, any there has to be some cause behind it. So you need to find out the exact cause by taking good case taking. So it is only possible when you have a good case taking art, like you should know how the pain aggravates and you should know how the pain ameliorates. So this all information can actually help you in choosing the simillimum which can help the patient, but it is only possible when you take good modalities, good case taking, good history of the patient, how it happened, then only you can help him out. So starting with cervical spondylitis, there have been many remedies according to like materia medica. There are many remedies which can affect on cervical spondylitis. Like for example, you can start with belladonna, you can start with simicifica, but definitely the symptoms has to match. It's totally based on the symptom totality. Don't think there is any specific for that. Yet there are many medicines which has the action on that particular area well, but you need to select on the symptoms wise. For example, like if you think the patient is complaining, like the pain is beginning in the nape of neck and shoulders, extends over the arms, and they feel like they don't have senses, or they feel like their arms are powerless, like moving hand or grasping anything, like it can excite the pain more when they move their hand or grasp anything. So then you can think of more dominantly left sided is more compared to right sided. Then you think of Paris quadrifolia. It's very good remedy which has the action on it. Then the next remedy which you can think of, lecnanthus. When you have to think of, when the neck becomes stiff, the head gets drawn to one side, it's totally stiff, and the pain is splitting. The patient will tell you there's a bursting pain when aggravates. As soon as they move the head, it gets aggravated. So generally it is more on the right sided. So Paris is left sided, lecnanthus is right sided. And then you have sanguinaria canadensis, stiff neck when it's right sided, great pain of the movement. The pain is confined on the shoulder, more on the shoulder, more on the trapezius muscles. You feel like more pain, they cannot lift their arms, है ना? And when they sleep on the affected part, they say that my hands go numb, or it gets aggravated. And then you have lycopersicum also acts well. Then next you can think of Oreo-Daphne. When you can think of Oreo-Daphne is a very good remedy when they have cervical occiput. From cervical and occiput, these both regions they get affected, and these extend to the scapula, to the spine, and also the pain can go into the ears, and they have great heaviness and headache, and they have a constant desire to just keep on moving the head. They keep on move the head, and it does not give any relief when they keep on moving the head. So Oreo-Daphne is a very good remedy for that when they have the action on cervical and occiput. The next you can think of Theridion, when there is lot of nausea, a lot of vomiting with the spondylitis. Then there is a Kalmia as well. Kalmia when they have the numbing pain which comes and goes. Kalmia pain, electric, like which pain comes and go from neck to the right arm and the hands. Next you can think of simicifuga. Simicifuga is actually when there is a pain, when there is a neck portion is used, more pain is on the neck side. Like you can who works on the more of computer, and they have played piano boards for hours and hours, musicians, they have continuously like sitting very in a long hours, so there is a stiffness and rheumatism of the neck, so that is more indicated in simicifuga. The pain and stiffness is also in the shoulder areas. Then you can think of ranunculus bulbosus. Ranunculus bulbosus, they actually the pain is aggravates in the morning hours, and any sort of movement aggravates the pain. Even the moving head aggravates the pain, and the pain is associated with the numbness of arms. And there are many remedies actually which can be helpful, but it's totally based on the symptom totality. Don't be in a just that all any remedy you pick up and you give, the patient will be feeling better. That's not the point here. The point is how you understand the patient character of pain, and how it occurred, that is has to be understood before treat the cause first. So coming up with lumbar pain lumbar pain, there are many remedies which can be very helpful in lumbar pain. Like nowadays you have seen like various when after injuries in the spine or the skeletal part, they have like lot of bone spurs in the spine. Also you can find them in spondyloarthritis. You can find them. You can think of the remedy is polygonum multiflorum, where there are a lot of bone spurs in the spine. After injury or skeletal or any damage or trauma can lead to this. Even the degenerative stage, there are a lot of bone spurs forming in the spine, leading to a lot of complaints. You can think of polygonum multiflorum. Then you can think of more in spondylitis, carcinosin, medorinum, oleum jacoris, macrotinum. Then when the patient complains that they feel that the pain is separated in the sacroiliac region mainly, that can be calcarea fos. Then you can see pain in sciatic nerve when it begins in the lumbar region, when there is great stiffness in the sciatic nerve that begins in the spine, especially in the lumbar region. When then there is a great stiffness, you can think of curare. Then back pain with fibrositis, you can generally a lot of patients complain with back pain with fibrositis. The remedy which is mostly helpful, that is psychotic co. Then an ankylosing spondylitis, there are many remedies which can help, like bambusa an excellent remedy, butyric acidicum, radium bromide. Then osteoarthritis of the spine, bacillus 7 is wonderful remedy, calcarea fos, medorinum, morgan pure. Then people who have been post trauma after any railroad accident, you can think of belispa. That is the only remedy which helps, as indicated. It's called as railway spine when they have any history of railway injury or any railroad accidents. And one very helpful remedy is agaricus muscaris, especially in ankylosing spondylitis. They have that feeling that spine is stiff as a board, and they feel that the spine would break. So very severe arthritis of spine, when there is burning pain, shooting, and they feel like hot or cold needles are being stuck in the spine, and there is a lot of tingling deep in the spine. In fact, you can differentiate it well. When the patient sleeps, he complains that he feels lot of tingling. Causticum and agaricus both are highly indicated for this. Lot of tingling while sleeping in the limbs while sleeping. So coming to more remedies, let's do differentiation. Colocynth. We all know how colocynth is helpful in these acute crises, like screams in pain, anger, contraction of muscles, sciatic pain. They are better with pressure, lying on the affected side ameliorates. At night, mainly actually worse sleep, at slightest motion they get worse. Then next coming up for McFoss. McFoss is like always lamenting about pains, complaining pain. And there are spasmodic contractures in the pain. And there are during the day they are completely well. At night they keep on complaining. And majorly you think of colocynth on the left sided, McFoss is right sided. Colocynth is ambithermal, McFoss is chilly. So thermal is very helpful in differentiating the remedies as well. There is also tingling in the left toes in McPause. And patient complains of pain after getting into the bed. Then coming up to next, diascoria. Diascoria is very very marked in back pains as well. Well, diascoria is the strongest modality in the patient tells you that when they bend backwards, they feel very, very relaxed. That is a strong keynote to differentiate with other remedy, diascoria. When the patient asks the patient to bend backward, they'll say, I'm feeling much, much better. So, the drawing pains in the sacroiliac joint, actually, more of the spinal cord feels bruised the way up and down, and there's a very very sharp pain in the back. Coming up next with valeriana. Valeriana is excellent remedy. Majorly, you should ask the patient to stretch their legs while sitting. They stretch their legs, and when they feel pain on that particular limb, that's valeriana, and majorly indicated for hernia disc herniations. And there are more of mentally disturbed. Valeriana is more mentally disturbed. They have a lot of grief, and valeriana is more to the right side, and walking ameliorates. Same with rustox. Rustox has to be differentiated. Rustox is left sided and valeriana is right sided. So coming up to the next is phytolacca. Phytolacca patients tells you that they have in great pain. They feel that uh, they will die for sure. They have so much pain. Phytolacca is majorly on the right sided. And pains, they complain of fly like electric shocks, hips, thighs, change of feather, worse motion, extension, and they feel better when they elevate their feet. Sharp cutting pains. Then the next remedy, which is I think everyone knows about it, that is Nephilim. Nephilim, when to use Nephilim? That's the question is. First of all, Nephilim thermal is chilly, and Nephilim is more of right-sided predominantly, and there has to be intense numbness which is associated with this pain. Lot of numbness, and then only you can think of Nephilim. Lot of numbness. Coming up next with Ammon muraticum. Ammon muraticum is here the pain is very very severe, and Ammon mur is left-sided, and more of tendons. The tendons, that they have more pain in the tendons, and they make them they walk like sideways while walking. They are one-sided bends. One more remedy you can think when the patient complains of the backache, and they have lot of backache and in the pain in the sacrums, and they cannot rise. It takes long efforts to rise. They cannot rise suddenly. Matlab, they take lot of attempts to rise from a table, and even if they do that, they will bend one-sided and they'll rise up from the seat. Think of asculus hippocastum. It's highly marked in this type of sacroiliac pains. Next, calcarea carb. Calcarea carb, generally it's very very chilly, and the pain generally aggravates from cold. And calcarea carb, when they work in lot of water, they have some work, and because when the person was continually exposed with the water, they work a lot of underwater, the joints are affected. Think of calcarea carb. Next remedy you can think of euphorbium. Euphorbium is very good medicine when there is tingling pain relieved by motion. When they walk, the tingling gets less. Euphorbium is very marked remedy for that. Actually, it's somewhat related with rustox, but the tingling is relieved by motion in euphorbium. Then ferrum met. Ferrum metallicum is right-sided, as we all know, but the pain, where the pain is, Ferromet pain is on the hip joint, mainly in the hip joint, and it starts from the evening till the midnight, goes on and on and on and on. And in this, the patient, although he can hardly put his feet on the ground, when he walks a small bouts, he feels relaxed. So, motion amelioration here again in Ferromet as well. Next, Kali iode. Kali iode is an excellent syphilitic remedy, and the pain modalities is worse at night. Well, it is a syphilitic remedy, so pains aggravate at night. And yet again, Restox like modality, pain is better by motion. So there are many remedies which I am going to discuss in this today's session. I think it will be helpful for everyone to learn as well. Kali Phos. Kali Phos is a very good remedy when there is patient comes and tell that they have pain in the sole of the foot. They're extremely restless, and they have pain in the sole of the foot. Then you can think of ledum. Ledum pal is very helpful in assessing sciatica.
I didn't get.
Menianthus trifolata. Menianthus trifolata has a very good pain, and it has a peculiar indication actually. The pain throws the affected thigh and legs spasmodically upward in jerking. When the patient is sleeping, due to pain, his limbs get jerked upwards. Right? So this is commonly indicated in Menianthus trifolata. Natrum mur. Natrum mur is also indicated remedy, and it has major action on right sided hip. Plumbum, when there is a worse wasting of muscles, you can think of plumbum when there is atrophy. The next remedy, you can think of ruta. Ruta is indicated in sciatic pain, also in ascending sciatica. Ruta is also indicated, and of course when there is injury history. And the ruta pains are very deep, like bone in the coming from like as if in the marrow, in the bone marrow pains. One amazing remedy when you can think when Nephilum and Colocin gives you no result and indicated well is aurum iodatum. Aurum iodatum should be considered in right-sided sciatica when there is strong pain and numbness. Of course, when there is aurum, there has to be depression, restlessness, and aurum iode is hot, so aggravates from warmth, and they love open air. Next remedy is indium metallicum. Indium is very sleepy and irritable, and pain is worse when they just start to beginning of moon, like beginning of as they start as soon as they start to move, the pain gets worse. That's a marked modality for indium metallicum. Also, indium metallicum has like stiffness in the neck and the shoulders as well. The next remedy is indigo. Indigo, patient comes and tells you that their nates, they feel like somebody is pricking in nates. That's indigo. And every meal, as soon as they eat, they start getting pains. So after every meal, they start getting their pain aggravated. And there is very strong pain from the middle of the thigh to the knee. That's the only remedy that's indigo. From the middle of the thigh to the knee. And they are better by walking. Next remedy, sciatica every winter. You can find only two remedies actually, Ignitia and Viscum album. We are going to discuss both. So first, coming with Ignitia. Ignitia is very marked when there is painful sensibility of the soles of the feet. When they are walking, shooting pains, and they feel like, ulceration, as if some there ulcer in the soles of the feet. They have so much pain, and majorly ignitia pain is on the posterior surface of the thigh. They have extreme weakness. The limbs are swollen, thigh becomes knotty, they cannot get up, and also they have burning in heels at night. So viscum album. Viscum album is indicated when there is extreme shooting pain from the sole to the head. Malignant hypertension plus sciatica, think of viscum album. So another which is very helpful remedy, that is salicylic acid. Salicylic acid, it is very very helpful in RA. RA when during climaxes the pains disappeared and the engorgement of fingers subsided. Actually, there is a case which I read about it in salicylic acid, when during climaxes the pains disappeared. The patient was suffering from RA. During climaxes the pain disappeared, and there was a complete swelling in the limbs that got subsided. So during climaxes, if the patient started RA or suffering from rheumatic pain, you can think of salicylic acid as well. In lower limbs, as if foot were in ant hill, there was so much of burning in left sided. Left side is sciatic nerve. They have so much of burning pain that you can think of salicylic acid. But salicylic acid is predominantly on the left side. Then comes elatrium. Elatrium is also a wonderful remedy, but with a history of suppression of malaria, because all elatrium complaints get aggravated after that, suppressed malaria effects. In fact, elatrium is also a helpful remedy in newborn jaundice, when the infant suffering from jaundice. And the pain of elatrium goes left sided is extending to tip of toes. From left sided, from tip of toes, think of elatrium. And majorly they get aggravated in damp weather. Next, Nux vomica. Yes, Nux vomica is extremely helpful in the back pain, cervical pains as well. They are so much restless due to pain, so much of irritable due to pain. They get up at night and they just walk about due to pain. Like Macabre. Macabre is like restless due to pain, he starts walking. Same with Nux vomica. They start walking due to restlessness, due to pain. So they have rheumatic pains in the shoulders, arms. Coming to the lower limbs, they have sharp shooting pain in thighs. In the thighs, they feel all the paralytic weakness. They cannot lift their legs. They have so much pain in thighs that they feel as if broken. Also, they get fever during with sciatica, and they are worse by movement. And majorly during pain, they also start getting perspiration. So there is a specific rubric: extremities pain, sciatic nerve, trochanter. Especially they have more affinity on the trochanter. So perspiration with, that's Nux vomica. So coming up, there are many remedies like arnica, ruta, ledampal, hypericum, kalibai. Kalibai has that shifting wandering pain, majorly on the left sided sciatica. Tellurium met. Tellurium met has a very good indication when the pain starts from last cervical to the fifth dorsal. They're very, very sensitive to touch, and whenever they cough or sneeze, the pain gets aggravated. So there is also one remedy which is I missed, I believe, Gaultheria. Gaultheria is also an excellent remedy with inflammatory rheumatism. So, concluding to my session, there are many remedies in the Materia Medica, but you need to see the character of the pain, then only you will be able to differentiate it well, as well as the thermals of the remedy. So you need to read remedy with their sphere of action, their affinity, their aggravation, their amelioration, everything from top to bottom has to be matched. Then only your patient will be relaxed after you select the right remedy. So this is the way homeopathy works. You need to figure out the exact totality, then you have to match with the remedy, and then you prescribe, then only it will give results. So concluding to the session, I'm very, very thankful for everyone, whoever is listening. Thank you for coming, and hope you learned something new today, like we all should do every day. Thank you, everyone. So I hope everyone has learned few remedies which are very, very helpful in these degenerative conditions. So take the totality and prescribe and see the results. Thank you.